Welcome to She's Got Guts, where functional nutrition meets ancient wisdom to bring you grounded insights and practical tools for your wellness journey. Join Laura, licensed Eastern medicine practitioner and wellness wizard, and Molly, registered dietitian and gut health expert, as they unpack trends, tackle bloating, balance hormones, and help you thrive in modern womanhood without completely frickin' losing your mind. Let's do this. Welcome, Kaitlyn. How are you?
Good. I'm excited to be here. Excited to be chatting with you all today.
Excited to have you.
All right. So we know that you are a pediatric dietitian. There's so much that we don't know about you. So tell us, first of all, what a pediatric dietitian is, what a lactation consultant or specialist is. Tell us all those things.
So currently in my role, I work in clinical as a pediatric dietitian. So there's obviously outpatient, there's a ton of different roles that they can take. But what I've been doing is working mostly in critical care. So I work in the NICU with the little babies, preterm or term babies that have had complications. And obviously that's a very high stress environment. Lots of moms who are confused and they weren't expecting their baby to come so soon. So I do a lot of that. I do nutrition through enteral nutrition support. So tube feeding. Most NICU babies are not able to eat orally yet because that part of their brain hasn't developed. So we give them the best nutrition possible through tube. And obviously their nutritional needs are much higher than a term kiddo. So I do a lot of that. And I also work in the pediatric CVICU. So these are kids that have had congenital heart defects and they often have surgery very, very young. So I'm working with a lot of little babies. That's most of my job, mostly just in the critical care side. But working in the NICU, I've gotten really into our lactation consultant team is amazing. So that's what prompted me to go out and become a certified lactation counselor so that I can better support my patients. Even though we have a great lactation team already in the hospital, they are very busy. They're in very high demand. They also cover L&D. So this way I can be able to support them without needing, consulting lactation. Come on, I know your day's already busy.
I see.
It's really been game-changing for a lot of, especially my NICU moms, but some of my CV moms with really young babies. It's great to be able to do both.
Yeah, that is amazing. And then you're also doing some coaching of sorts, right?
Yes. So I recently launched my private practice where I'm doing postpartum mom nutrition coaching and lactation coaching all in one. So it's an amazing program that's it's different than a lot of the lactation courses or nutrition courses that you find on the internet because it wraps it into one, truly made for expecting moms to follow you through postpartum or postpartum moms that are struggling and are just how do I make it all happen and do it confidently? So that's recently has begun.
Yeah. Well, you're just in two different worlds right now. You're, giving the teeniest, tiniest ones that need the most tender, loving care food through a tube and then telling moms how to, nourish the ones that are out and ready to receive, breast milk or a bottle or something. That's a big deal. So what are the commonalities with, nourishing mom, nourishing baby? What do you see that is a common theme aside from mom's really depleted and the baby needs to stay alive? How do you kind of approach that mindset with people? I guess maybe when you're coaching and even in the hospital.
Yeah, I think something that's very common in both worlds is moms feeling a lot of stress and anxiety and guilt around their choices. So I see a lot of moms that end up even in the NICU, they're so stressed about their milk supply and trying to do everything they can to provide for their baby that they end up neglecting themselves. And that takes a big hit on your milk supply. And now you're thinking, oh my gosh, there must be something wrong with me. I'm doing something wrong. It's hurting my kid. And there becomes, it snowballs very quickly into this guilt, neglecting your own health because you think that you're prioritizing the baby when at the end of the day, I help moms kind of rewrite that narrative where prioritizing themselves is what prioritizes your baby. Being able to put your best foot forward in your own health, nutrition, and wellness is what helps at the end of the day.
Yeah, we're certainly not trained that way in our world.
Yeah, I could say the same goes the entire length of the baby's life, right? Like mom
Yeah.
is always putting the baby ahead of herself. I certainly see that with people who have older kids as well. So I can only imagine at first when you're new that the whole thing.
Yeah,
Oh
it
my
is.
gosh.
It's very overwhelming. There's very steep learning curve to being a new mom, breastfeeding, pumping, whether your baby came at their due date or not, you're never going to be prepared or know what to expect. So that's where I try to really, especially working with expecting moms, I try to help them be as prepared, know what's realistic, because I think that makes a huge difference in the long run, not letting yourself get to the point of struggling.
Yeah. How do you support mom?
Yeah.
Can you contrast for me how you support a mom in the NICU where, the focus obviously is keeping the baby very alive. We want the baby alive.
Yes.
How do
Yes.
you what kind of focus is there on mom in that sense?
Definitely not enough focus on mom. And I think
Yeah.
the whole team is very focused on caring for the baby, which, yes, that is our job.
Yeah.
But also,
Sure.
what's best for the mom is best for the baby, too. And we have a lot of hard talks in the NICU about formula. That's like a really big point where I come in and I end up bonding with the family a lot, because most premature babies or babies who are sick enough to be in the NICU have very high energy, protein, micronutrient needs. And breast milk is an amazing substance. It is amazing what our bodies can do. But at the end of the day, the reality is that it is not enough to sustain the growth, brain development, and bone density of a preterm infant. So we come in and we have this hard chat that we have to fortify your breast milk, and that is really heartbreaking. And I think that's where my relationship with these parents starts to open up, and I really bond with the moms, because someone that actually takes the time to explain that to them and not just tell them, okay, well, this is how we're doing it anyways, because this is new to them. They have no idea. Formula has such an ugly light on the internet and social media, and it's truly life-saving for so many of these children. So having that hard conversation is where we really get to know each other. And I think that ends up forming a bond that's very strong, and I'm able to provide support that the rest of the team doesn't always. They do their best, but they don't always recognize that the moms, they're there every day. They're staying the night with their baby. It's not easy. Their alarms are always going off. Like, they need that too. Someone to explain, this is why we're doing this.
Yeah.
Do they feed mom?
No.
Dang
No,
it.
actually,
That seems like such a necessity. Like, why are they not also? I mean, she doesn't obviously need fortified milk, but she needs something. Who's feeding mom in these scenarios? Is it their community that's taking care of them?
So it's actually something terrible that we have this rule in the NICU where the moms aren't even allowed to eat in the patient room. So we have these beautiful patient rooms that look like hotels. There's sinks, there's bathrooms, there are couches and beds, and it's quite the setup. It's like luxury hotel. But the parents aren't allowed to eat because of sterility and trying to be as sanitary as possible. So they're required to go out into the lobby, which I get the reason why there's a rule. But so many parents don't want to leave their baby because they're worried something might happen. And that is so valid. I would probably feel the same way. And that's where they really often end up neglecting their own nutrition.
Man, that is a slippery slope that can't be fun to try to work through in your brain, just sitting there with your baby. Like, I'm going to be with you the whole way. And then you're like, but I'm going to pass out because I'm starving.
Yeah.
Oh.
Yeah. The NICU life is full of finding out a lot of not fun roles.
Yeah. I want to go back to this piece that you said about breast milk not being fully ready for the infant that needs higher nutrition. And you're kind of blowing my mind a little bit here, because I feel like it's something that we should understand. In that when the baby is inside of the womb, you are getting all of the nutrition that you need, hopefully, right? And you can take as much from mom as you maybe need. But in the scenario where you come out and mother's milk, the baby should be developed. It shouldn't have to have that high source, because imagine what that would do to mom. Like, that's really smart of Mother Nature. That is, I don't know, the physiology of that is just really amazing to me. So what is it? You said the micronutrients and macronutrients. You said both of them, especially for bone and brain health. So you're getting a lot of extra fats. And like, what are you putting in there that these babies need extra of?
Yeah, so our main product that we use to fortify mom's milk is called a human milk fortifier. So it's designed for preterm infants. It's not just a standard formula you buy on the shelf. And it has all extra vitamin D, A, E, things that will help support their brain development.
Yeah.
And it also has extra iron added to it because we're drawing their blood all the time. We have them on ferrous sulfate supplements to support, regenerating their own blood cells, try to reduce transfusions. It increases the protein dramatically because breast milk doesn't have much protein in it. It is the golden standard, and any mom that's producing breast milk, I'll use it 100%, but it does not have enough protein to support the development in these organs because essentially when you have a preterm baby, they have not finished developing.
Right.
So they need this really energy dense, protein dense to finish developing their organs.
Yeah.
Their eyes, brain. We think about bone, like extra calcium and phosphorus, which the human milk fortifier has a ton of that. And everyone's breast milk is different. So yes, there may be some moms that are able to produce that really calorie and micronutrient dense milk, but it's rare.
Well, yeah,
It
and
is
also
rare.
under all the stress of the NICU and the baby came out early, and your
Right.
body's like,
Right.
You're not eating.
Yeah, you're not eating. Oh my goodness. Okay, so if the baby's fully developed, what are you looking at with mom to make sure with mom and baby what do they need to eat to make sure they're like thriving?
Yeah, well, I would definitely say the most important part is to know what you're getting yourself into, because when you have there's a lot of stress around what's normal with breastfeeding, like cluster feeding. The baby's always on your breast and you're like, I must not be producing enough, but that's actually normal and that's how your supply increases. The best thing you can do is the baby to the breast. But knowing how that all works before allows you to free up that mental load to focus on your own nutrition and your own self-care. So that's why I really prioritize that expecting mom education so that once the baby's here, you can focus on the things that require actual physical doing. And I try to also encourage like easy, realistic nutrition because that is such a big thing. Is I could give you this beautiful meal plan, but at the end of the day, if it requires you spending hours in the grocery store or at your stove, that's not going to work when you have a newborn.
Yeah.
Yeah.
Trying to prep ahead and prioritizing all the extra calories because when you breastfeed, it burns like an extra 500 calories a day, I think is the average. So some women even more than that, which there's that whole trend of you lose all the baby weight when you're breastfeeding, that's because you're not eating enough is actually what.
Yeah, it's hard to not get depleted because you get so tired. I've been asking a lot of questions, Molly. What do you got in your noggin?
Well, I was thinking I wouldn't have, because I don't have kids, but I wouldn't have even thought about like the amount of people who are probably looking for something that's like, how can I get ready? Like I think, as my personality, I'm like, I want to know as much as I possibly can to combat any fear.
Yeah.
Because the more that you know, then the less fear you have. But how do you it's not like your doctor's like, oh, here's some, classes that you can take.
Right.
And here's like all this education and make sure that you're ready for this. Like none of that, is really part of the standard of care. And so to think like, wow, there's a place that I could go to learn what I want to have ahead of time and what to expect in terms of like, yeah, okay, so on the internet, it's going to say that if you breastfeed, you'll lose all this weight, but you don't want that. Like no one, tells anybody that. Like, and I just think that's so interesting and amazing. So tell me how you came about with this idea. Like, okay, how can I get this education to these moms ahead of time? Like, was it when you were in your schooling? Was it when you started in the field? I mean, I'm sure you didn't plan to go directly into pediatrics, or did you?
So I always wanted to do pediatrics, and I know you're familiar with the dietetic internship, but for anyone that's listening that isn't familiar, the internship is like matching into med school, and it's very high stress. And I did not get placed in a pediatric rotation, no matter how bad I worked for it. I had all the hours, and it just didn't happen. So I thought I would never be able to get a job, and somehow I got really fortunate. So thank goodness. I'm very grateful. I've always wanted to do this, but I think
Oh, cool.
what I thought it was is completely different than what it actually is. So, and
Right.
I think really where I started coming up with this idea is seeing, like what I was telling you guys, almost neglect of the mom in the NICU, and also just the lack of knowledge that I see there. And it's no fault of their own. It's the way that our society is structured, that we're told
Right.
it'll come natural, it's easy, don't worry about it. Pretty much like dismissive, I think is very much how we are around breastfeeding and taking care of yourself postpartum. There's very little support out there. And seeing that in real life, just kind of aha moment for me.
Yeah, for
Yeah. Oh my
sure.
gosh. Yeah. Well, and I think, in a hospital, there are so many things that are kind of a bummer when you get out of your training, because you go through all of this stuff to become a dietitian. And then you're like in someone's room and they do not want to talk to you, or, there's not really with it. Or in your case, like obviously it's not like the fun side of pediatrics. It's like the not fun side of
Right.
pediatrics. And, that comes with a lot of bureaucracy. So I can completely understand why you would want to spend more time with these moms. So tell us, like, what your philosophy is overall. Like, when you see trends out there, when you see different things that are coming up that are more popular, I know it's hard to go outside of that scientific lens that we're like so honed in on. So how do you do that?
I think at the end of the day, there's all these trends, but what matters is the basics. The basics is what will set you up for success. And I'm sure you guys see this so much with your clients too, because at the end of the day, it's all back to the basics, the simple stuff. This is how milk supply works. You remove more milk, you make more milk. Stop wasting your money and time on the lactation supplements, these trendy ways to pump, and stop overcomplicating it. Simpler is better, because you will actually do it and it's what actually works, and there's science behind it. I think that's the thing too, is people don't realize all these trends, there's no evidence to back it. And it's scary. I have a lot of postpartum moms that come to me and I've tried everything, but they haven't tried the actual essential driving factor behind your own nutrition is eat enough, eat a balanced diet, everything in moderation, build your plate. Like, the nutrition that works for a postpartum mom isn't that different than the nutrition for you or I.
Right. You just need more of it. And sometimes a lot more frequently, and a lot more fluids too. Like, you're making fluid. You need extra, like an abundance of fluid. So, I think about this from a Chinese medicine perspective. And when we have things that we're overthinking or stressing or worrying about, it can really interfere with our ability to be able to not only bring in our food and nutrients, but then manufacture them into what our body is set up in that moment in time to do. So for a nursing mother, it would be, okay, how are we putting all the systems in place to make sure that we are able to produce enough milk? And, the points that you mentioned about, if the baby is actually on the breast and what you get rid of, you'll replace, like all of that stuff. But what it obviously is very essential. But what I'm thinking of is the ability for the mom to be able to relax. When you think about, I think one of my favorite things with nursing my boys was that it was a time that was so incredibly peaceful. And I can't really think it was difficult, especially at the beginning. But once we got these two little, once my humanness and I had both boys, their humanness was connected in a way that we knew what our pattern and routine was. It was extremely peaceful. I mean, I had trouble with my first one. And then the second one was like, wanted it all the time. So I was more like, oh my gosh, I can't keep up with you. And I definitely had stress with having enough of it. And that was a chicken or egg in terms of how I was be able to relax. And in Chinese medicine, it's all about like having the liver qi be very calm and not feeling like everything has restriction and you're, up against a battle every time you go to do something. But with each movement, there's ease. So I wonder, with strategies for you, how you truly help keep mama calm. It's really hard.
Yeah, 100%. And being stressed is not helping your supply either. There's a lot of research out there, cortisol impacting your milk supply. That's real.
Yeah.
So I think the biggest thing, and I know I've said this, I feel like a million times already, but understanding how it works before it happens.
Yeah.
And knowing it is normal. Cluster feeding is normal. The first 24, 48 hours, they're going to be attached to you. That is normal. It's also normal if they're not for a few hours because they're tired and they just had a very traumatic entry into the world.
Yeah.
And that's normal too. So, and I think there's so much pressure around making enough milk. So I'm glad that you brought that up because that is probably the number one thing that postpartum moms come to me saying, how do I know if my baby's getting enough? And it's really quite simple. Is your baby growing? Is your baby making enough wet and dirty diapers a day? Let's not overcomplicate this thing because 90% of the time their kid is growing great. They're getting everything they need. And it's just the mom that's stressing and worrying and she ends up supplementing formula, which nothing wrong with that, but she never needed to in the first place.
Yeah. So what's that pivot point that moms could look out for? Maybe like maybe a picture you could paint for us of maybe how the mom is feeling in that moment where you're kind of teetering on spending too much time in cortisol land and not enough time just relaxing and being in oxytocin land and letting the process take shape. Like, how do you know when you're teetering into actually being aware that mom is deficient? Like she's feeling this way because her blood sugar is very low. That's going to make you feel like you're in cortisol land. Like how do you know as a mom where you're like, okay, this, and this are happening. I need to eat or I need to prioritize me now.
Yeah, I would say if you are exhausted all the time, that is not normal. I know everyone says in postpartum, you're going to be tired. Yes, you'll be tired. You're up every 3 hours with the baby.
Yeah.
But if you are drained and at your mental capacity, that's a sign to get help. That's not normal. And we should not push through that.
That's really good to know.
Yeah, I think there's a lot of narrative, especially what you see on the internet, that this is the norm. Just because it's common does not mean that that's the healthy normal.
Yeah. And I would imagine that women who have been through a birth with maybe more loss or maybe a surgery or blood loss or maybe a surgery or something along those lines, that they might be in a place where they need more support a lot quicker when trying to nourish the baby. What do you suggest that they eat? What do you suggest that mamas that have maybe like lost a lot of blood or, are you putting them on any supplementation? Or are you like, you need to take, glandulars or liver, bovine liver, or are you like, I'm a little woo-woo, so I'm going to say, are you telling them that they should have encapsulated their placenta? Like what do you love to give them that helps them with that sort of picture?
I always recommend continuing your prenatal multivitamin because I think not enough people realize you still need that even though you're no longer pregnant.
Yeah.
Because the baby has stripped a lot of your mineral stores, your vitamin stores. You need to continue repleting that. And that comes from multivitamin is great. It's kind of like, okay, the stress is off. I know I'm getting what I need. And now I can prioritize food I actually enjoy that's still nutrient dense. And, foods from the earth, I'll always recommend. It also depends on how people feel about it. I love that you're a little woo-woo, like the placenta. That's amazing. Not all of my clients go for it, but if you love that, 1,000% support you because we know it's very nutrient dense.
Yeah.
So if that's your thing, let's do it. And if it's not your thing, let's find the foods that work for you. And we go through what do you actually enjoy? Because you should not feel like you're force feeding yourself just to like do the quote unquote right thing and making it, like I said, realistic, convenient. What are things that are accessible for you? What's your typical grocery list look like? And we go through all of that to actually make a plan that works for you. And I think so much of it is not focusing on the actual food, each food product. It's more eating enough and eating frequently.
Yeah.
People think, oh, well, if I eat this really unhealthy food, my milk is just terrible for my baby. And that's not true. Your body will always prioritize the nutrients for your baby. And that is why moms are left so depleted.
Yeah.
Because the body will prioritize the baby over all else.
Mother Nature, man. She's smart. So smart. But also not. Because what about
I'm like, what? I wanted to ask about the Eastern medicine principles, Laura. So I know that how can we integrate this into when we move into Kaitlyn's program and talk about kind of how we're caring for these women? What don't they have someone that cooks for you and does all this stuff for you?
Yeah, I would imagine it's usually grandmothers or, great grandmothers, other great aunties of that sort. You create a container of ease for women in traditional Chinese medicine. You don't want them exposed to really anything that's extreme that makes their body have to work to deal with it. So, for example, no ice cold water, no naked feet, no going outside in the cold, making sure that you're taking daily baths with things that help heal your tissues and nourish your blood and your tissues. Lots of cooked food with high caloric like meats, like you see a lot of like beef stews and things. Lots of functional mushrooms or mushrooms cooked into there. There's also some other like herbal porridge type stuff that you might add in with things like, datsao berries or goji berries. They kind of taste good, but they're also really nourishing for the heart and the blood. And depending on if the mother is showing something pathogenic, you would maybe reach into some different medicinals. If she's very anemic, you're gonna want to include a lot more foods that have, iron containing nutrients in there, but then also you'd want to supplement the herbal choices along with that. But I think the biggest piece is just remembering that you don't want to stress, exactly how you've been saying it, that the research does show that stress isn't helpful. Like you don't rejuvenate, rebuild, and become abundant when you're stressed. And so you need to keep the mother like a queen and have her be literally waited on. Like I remember after I had my kids, as helpful as everyone wanted to be, my ex-husband, now their father, had to go back to work after about a week. And I remember being so tired and so depleted and having the stress of like, I should probably have the house look nice. And when they come home, or, I only have so many moments of sitting down. I have one very, very strong moment that I wish I would have done so much more of, where I was like, I am just gonna, like, Clyde was nursing and I was sitting on the edge of the couch and I was so tired, and I made sure to bring my water and my smoothie with me. And I was like, I'm just going to turn on a movie. And that is like the one moment that I remember being so present with him as a small infant. And I think about it now and it almost makes me emotional, because I put so much pressure on myself to do all these other things, when really, for honestly the first year, the only thing that matters is that I eat and sleep and be taken care of and feel loved, so that all of that just feeds right back into the baby.
I love that.
It doesn't matter if you steam your vagina. Just
that is a thing. That is a thing. Yeah, we use. You just.
That's not one of our top priorities.
You can yoni steam. That's totally great. I would think that the time to pull that off would be hard, but you can if someone prepared it for you. We use good old moxa floating around in there, and it, the smoke is very healing for the tissues. It's actually, moxa is biphasic in its smoke form, and that the heat is really good to help nourish and move the blood. So it can be really, really
like an
helpful.
incense stick.
Yeah, it's dry.
Oh,
it's very,
just wave it
it's
around.
very woo-woo sounding. It's literally dried mugwort. Yeah. Aya is what we call it in Chinese medicine. Yeah. So you just burn it on there, but it can be really helpful, especially if you have like that, maybe like you have a clot that hasn't passed. Like that is so incredible. Like you just feel like someone has a bowling ball in your uterus and they're like pulling down on it, and it can be really distracting and stressful, aka you're not going to make a lot of milk. So you're like, what do I do to help with this? And the moxa can literally move the blood so that you can pass that clot. Yeah. Super fun. That old medicine is cool stuff. But I really think paired with what you do, Kaitlyn, is really where the magic shines. Because if you are in a scenario like that, they're not going to, you can't even bring food into the magical hotel room where the mom is, let alone burn matzo. They're going to be like, why are you burning the place down, you witch?
They might get a little upset already.
Oh, I would totally try to do it. I'd be like, stop me. Go ahead.
Okay. My last question is, does anybody ever mention local topical progesterone after the birth, like a couple months after the birth, to help with healing and sex drive? Do you ever hear anybody talk about that?
No. I'm so intrigued by this. I've actually never.
Did you see it on a reel, Molly?
I'm like, where did you get this?
Unfortunately, I just read about it in a stupid article. Cool. But it's been, I've had a couple clients who have been postpartum, and we've talked about it and they've tried it. And so basically, it's like localizing. So you're not doing like a systemic hormone, but it's like localizing that lush, rich kind of healing progesterone. Progesterone can also calm you down. It's a little bit anti-inflammatory. So all of that, when you're applying it topically to the area, really does help with some pain and some dryness. And plus, it just kind of helps you to feel better, I think.
Yeah.
I don't know. I don't want to know. But I do think that, little things like that can be helpful. So I do encourage people when they are looking around and looking at trends, I mean, on this podcast, we go like the whole spectrum, like from one side to the other.
We like science
So
and
when
we
you
like
are,
food.
we like it all. But when you are hearing about random stuff, like, some people are really into the ancestral kind of organ supplements and some people are not. Ask your doctor also always, because like, I know that it's a lot easier. I know, having to advocate for myself for so many years, it's a lot easier to go into the doctor with a specific question than wait for them to be like, oh, try this progesterone. That might help. You know what I mean? So like, just little things like that. If you pick something up, start making a little list in your phone or something like that, so that you can approach your postpartum care with, should you have the time or the wherewithal or give a shit, but like, so that you can approach your postpartum care with a little more like of your own direction, instead of just waiting for somebody to kind of, because those, all physicians are different and every experience of the doctor is different. So I just wanted to throw that out there. But what I really want to know is, tell us what your program does, who it's for, and how people,
I love that
how
it's
people can be helped.
I love that it is so preparedness focused. I think that's really special, Kaitlyn,
Yes.
kind of what you've designed. And I would personally, along with Molly, not only do I want to know what you do, but I also want to know like what your magic is. It sounds like bonding with the families, which is really unique and beautiful. And like yourself, I would want to bond with you too. You are unique and beautiful. But yeah, what is your magic?
Yeah, so the program is called the Empowered Mama Method, and it's where we go through 12 weeks together, and it's split into a few different phases, but it's really targeted to start in your third trimester and build the full physical and mental toolbox. And I think the mental toolbox part of that is so much more important than people realize. So you have the tools to set you up for success. You have the knowledge and understanding to make it happen. And I follow you through the actual implementation of it, which I think is where the magic really is, because not everyone's going to have the same story. And what works for you is not going to work for the next person. And that's where we really personalize it, optimize it for your goals. And I just meet you where you're at, because I think that's something that's so missing in the postpartum community is it's not a one size fits all approach. I know you guys see that all the time in your clients too, and just customizing it to their goals, because what a lot of lactation consultants will tell you is not necessarily what the mom wants. And while that's what we've all been taught in our schooling, and that's what we're told is best, never pump, only breastfeed, put the baby on the breast, that's how you build your supply. Yes, but what if that's not how she wants to do it? So really transforming it into your own journey, and also making sure that you have someone in your corner advocating for you. This is the best way to meet your goals. What can we do together? What are you struggling with? Opening up your mindset to be able to get out of your own way to meet your goals, essentially. Because I think so many of us women get stuck in our own heads. Men just don't seem to have that problem.
They're like, they just want to be like, what do you need? I want to fix it. You don't seem happy. Do you need food? Do you need water? What do you need?
Right. And I think it's getting out of your own way to meet your goals, and also being able to change what the goals are, because once you actually are in it, you might want to do something different. And I think that's where it's really transformative. And I also work with postpartum moms that are struggling, because I have a soft spot in my heart for that. I don't think anyone should have to struggle. This should be a time that's magical and beautiful, and you want to remember it. And just like you said, sit on your couch and watch a movie, and who cares if your house is clean? It'll wait for you to clean it later.
Yes, whatever makes you feel relaxed. And at the moment, the remote control was just right there. So it's very
Yes.
Find your thing and just let yourself sit in it. Let yourself enjoy it. this phase only lasts so long.
Mm-hmm.
You want it to be as memorable and enjoy it as much as possible. Stop rushing through it.
Yeah.
Don't
that's
let yourself
a great advice for even someone like myself where they're 13 and 11.
Yeah.
That you're like, well, they're going to be good. Before it was like, oh my gosh, they're going to grow up and start talking to me. And now it's like, they're going to leave the house in the blink of an eye because they're already 13 and I barely even, like, presence is such a beautiful part of it. And being able to remember those moments, like when when we're traumatized, we don't remember, like we have different ways of remembering, like our brain tricks us. Trauma does a great job of not helping you not remember. So if you are super stressed out, you're not going to remember a whole lot. And they're only that tiny for so long. And they're so cute.
I know. Soak up, the newborn scrunch.
Yeah.
Like, enjoy it. They're so cute.
They are.
Smell them. They have that newborn smell.
Yeah. Oh, Kaitlyn, you do the greatest things. Thanks for being on. Sorry, I didn't mean to interrupt
you
there,
do.
Molly.
That sounds amazing.
Thank you, guys.
I want to take the course, even though because I need to learn how to take care of myself. No, I'm just kidding. But it sounds really wonderful and supportive. And how cool that it's a group. So other moms can be there for each other. It's a community that you're creating. That's really, really admirable. And all that while you're working.
Yeah. It's a lot, but I'm hoping to grow it, my private practice, enough to be able to cut down on my hours at the hospital. That's a big part of me. I've loved it. It has been life-changing, and I feel like I've grown so much, not only as like a clinician, but also just in my life, getting to see that, because I think it's an unknown world. Pediatric critical care is not, you can't imagine it until you're in it.
Mm-hmm.
But I really love helping these women just feel their absolute best. And I feel like I'm able to do so much more for them than you can in the inpatient setting. I say life-changing, but it truly is life-changing, and seeing their transformations, the way they think of themselves, it's amazing.
Oh, and they're lucky to have you by their side.
They are. They are. Okay, so I'm dying to know about this one more thing that Laura was talking about. What is it with the cord?
Oh, yeah.
So
I'm imagining in the NICU that you're not an L&D, but when you're in the NICU, you may or may not have come across this, but there are people that talk about, is it better to clamp the cord really early and take the stem cells and save them for later? Is it better to let the baby have the placenta, the blood from the placenta come back into the baby, because it all goes into the placenta when they're coming through the pressurized birth canal? I know that I thought that the umbilical cord was probably one of the most beautiful things that I've ever seen. Like, I honestly thought it was like something from the depths of the ocean. It was sparkly. I know that sounds weird, but it was just like iridescent and beautiful. And honestly, I'm very woo-woo. I was like, I just need to chomp down on this thing. But we let the blood go back into the baby. That's also a very Chinese medicine thing, like literally wait until it stops feeding. But I was curious where you stood on that. I know that you might not be so integrated in that, not being in labor and delivery, but what do you think about that?
I mean, based on my own experiences and research, I'd 100%, if it was my baby, let the cord turn, white blanched, let all the blood go back, all the nutrients. I mean, there's so many nutrients, right? The placenta has fueled them for months and months and months. So why not take advantage of all of it?
Yeah.
So if it was me and my child, I would 100%.
Yeah. 100%. It seems like it would make the job of, well, first of all, it seems really natural to just be like, okay, let's chill for a second before we rush through this process. And second of all, like, don't you want your baby full of all of the blood, holding all of the nutrients that it could possibly have, to make your job of providing those nutrients even easier, especially if they're brand new. But I'm glad that's different when they're come out a little early. But
yeah, I know NICU is a little different, because a lot of times the baby's got to go and they got to go right now.
Sure.
But you have to think with all the blood draws that they do, like, that would still be extremely beneficial, weighing the risks, benefits. I'm not sure. I wonder if they do that for some of them, if their like respiratory status is able to hang out with mom longer. Yeah. So I feel like the benefits from that have got to be monumental.
Well, you better just get your butt in there and tell them that if it's possible, they can.
Yeah.
They would believe you. You're very convincing and you have a great smile. So I'm sure they would listen.
Wow. Thank you.
So because this episode is going to come out Mother's Day weekend, day before Mother's Day,
Yeah.
what's a message you have to new moms based on your experience that you think that new moms could really, or even older moms could really use as a motivation or a gentle hug?
Yeah. I think so many moms hard. It's a really steep learning curve, especially in the early postpartum days. You're learning a lot really fast and it will feel hard. But if that feeling doesn't leave and you're weeks, months into this and you're just drowning and struggling, it is okay to get help. That is what people like myself are here to do. We want to support you. There's no shame in that. Sometimes that's the warm hug that you need, is someone to hear you out and help you make a plan to get back to who you want to be. I feel like so many moms say they feel trapped in postpartum, really mentally. There's so many struggles. And I'm no therapist, but you're not alone in that. And it's when you can't get out of that you really should go seek help with whatever you're struggling with. It's not easy.
Yeah.
It's not easy.
Well, thank you.
Yeah,
I'm
thank
sure
you.
that means a lot to a lot of people.
Yeah, thank you.
We are so happy you came today.
I know. This has been amazing. I love it.
Okay. Well, we'll have you back anytime.
Where can people find you?
Yeah.
Something's coming out
My
of your
main-
mouth.
Don't worry,
I got
we
you.
edit.
No, it's perfect.
Okay. Where can people find you?
Well, I'm mostly on Instagram. I do dabble in the TikTok, but my main thing is Instagram. My username is @thebabyfeedingdietitian. And I feel like I built such an amazing community. It's still a little small, but we're growing. And I feel like it's so strong. The women that are on there are just total badasses. I love getting to talk with them. Even if you're not my client, I still just love getting to hear what's working, what's awesome, and what I can help them that they're struggling with. It's a beautiful place. Come join us.
I love it.
We will.
Yes. That's
All
great.
right. Thank you.
Yeah, thank you guys so much for having me.
Of course.
I'm I need a podcast now.
You
I
totally
believe
do.
in
Thank you so much for listening. We offer personalized support to clients in many ways and would love to work with you. Reach out to Laura at Lala's Wellness and Molly at Women's Gut Health for more information. Unlock your full health and hormone potential with Super Cube, Boom Bomb, and Best Tea. Check out the link in the show notes for more. See you next Saturday.